So as you heard, there are several of your Republican colleagues who say they're unlikely to support this bill. Senator McCain, Senator Paul, maybe Senator Mike Lee, maybe Senator Ted Cruz. Is it over right now? Because you got to get this done by the end of the week. Can you bring them on board?
Absolutely. The basic principle is that we give the patient the power and give states the resources to provide care for those who don't have. So Mike Lee and Ted Cruz love that. And Susan Collins is always about, and rightfully so, bringing health care to lower-income Mainers. Her state will get $1 billion more, not because we put something specifically for Maine. We did the same thing for Virginia. They're not going to vote for us. But with that money, Maine can help provide services for lower-income Mainers. We think it's good policy, which therefore will get folks to vote for it.
Because, as you know, your critics are pointing out these latest changes that were only announced last night. The latest version accommodates Alaska, for example, and you're looking for Lisa Murkowski for her support by allowing Native Americans there, Alaskans, they could remain in Medicaid expansion if they enroll before 2020. So why was this last-minute accommodation so important?
A couple things. First, Native Americans have always been treated differently than others when it comes to Medicaid, with the federal government paying 100% of their cost. We preserve that. Secondly, Hawaii and Alaska have costs that are about 1.5 times the rest of our country. We did for both Hawaii and Alaska the same thing. If Medicaid is going to reimburse you on cost, it should reflect the cost of care, not that which is in the other 48 states. That's good policy. That also helps Hawaii. I don't think they're going to vote for us, even though it's great policy for Hawaii.
How will you guarantee that those with pre-existing conditions, Americans with pre-existing conditions, will have the insurance they need that is affordable to them after this bill becomes law? Because, as you know, so many experts are saying these people are going to be potentially in deep trouble if your legislation were, in fact, signed into law.
They absolutely will have protection in three ways. First, the legislation says that if a state wants to do things differently, the state has to first show that those who have pre-existing conditions have access to affordable and adequate coverage. And affordable means you can afford it. Secondly, governors. Most states have stronger protections than the federal government, but governors are elected. The people who fear this just assume that governors are scheming to take protections away from the folks who elected them to office. That typically doesn't occur. And thirdly, let me also point out, your supposition is that people can afford policies on the individual exchange now. If you're not getting the subsidy, you're paying $30,000 to $40,000 a year, and you're about to see a 20% to 50% increase depending upon where you live. That is not affordable. We're trying to replace that with something which works.
But you know, Senator, and you've seen it, a lot of these expert organizations, health organizations, say you're completely wrong. They're opposing your version of health care, including, for example, the American Medical Association, the AARP, the American Heart Association, and a whole lot more. We've got a whole bunch of medical organizations up on the screen who say you're wrong. This is a horrible deal. It's worse for the American people. How do you respond to these medical associations like the American Medical Association and the AARP?
Let's first talk about something they based their analysis on, a study by Avalier, which scored our bill over 20 years. The bill's only for 10 years. So Avalier said we cut $3.2 trillion, but that's over 20 years because the bill has to be reauthorized as 10. So folks saw that and said, oh my gosh, they're cutting all this money. Avalier totally.
Let me interrupt you for a second, Senator, but the Congressional Budget Office, which is supposed to what they call score this report, they can't even do that because they don't have enough time. They'll issue some sort of partial report, but something that affects a fifth of the American economy, something that affects so many millions of Americans, and John McCain keeps making this point. Shouldn't there be extensive hearings, extensive discussion, and not simply rush into this as you're trying to do before the end of the week?
If I may, Wolf, first,
yes.
It does not affect a fifth of the American economy. We don't touch Medicare. We don't touch the VA, TRICARE, or employer-sponsored insurance. We don't touch that at all. It is the individual market. It's the Medicaid expansion and Medicaid itself. But all that other stuff,
I was just pointing out that health care in general affects a fifth of the economy.
Health care in general, but not our bill, and that's an important distinction. Secondly, the CBO has to establish that we don't contribute to the budget, that we actually lower spending. Now, we will achieve that. As regards coverage, The CBO bases their decisions as to the number of coverage as to whether or not there's an individual mandate. The American people hate the individual mandate. We repeal that, which, by the way, has been shown to have no effect upon coverage. So the coverage numbers won't be valid because they're using something which Jonathan Gruber, who wrote the ACA, says is not valid, which is the individual mandate has an effect, which it does not.
Why not do what Senator Lamar Alexander, Senator Patty Murray, a Republican and Democrat, have been doing for the last couple of weeks, trying to forge some bipartisan hold on a second, some bipartisan cooperation to work out some repairing of the current law, the Affordable Care Act. Why not work together with Democrats and come up with some significant improvements to the current system, as opposed to just on a very, very narrow partisan basis making these changes?
For the last 3 years, I've been going to Democratic senators with a bill I wrote with Susan Collins that would allow a blue state, if you will, to keep Obamacare if they wished, and a red state to do something different if the individual market were failing. 10 different senators I spoke to. None would cooperate. None, not one. Now that
but
tells
they
me
seem
we
to be
can go
cooperating with Senator Lamar Alexander right now. He's the chairman of that committee.
That's falling apart.
It may be falling apart, but if you got involved, if the president got involved, maybe you and the Democrats could forge some sort of compromise. He's willing to work with the Democratic leadership on the Dreamers, for example. I suspect he'd be willing to work in a cooperative venture down the road on health care if your latest effort fails.
If our latest effort fails, I presume, but it takes two to tango, and I've never been able to get a Democrat to tango. And as opposed to maybe they would, if ifs and buts for candies and nuts would all have a Merry Christmas. The reason we're pushing for the 30th is because people in my state are paying $30,000 and $40,000 a year for premiums, and they're about to get a 20% increase, and I haven't been able to get a single Democrat to help me. Now, I'm not going to stop fighting for my people, because right now it's not just my folks, it's folks in every state across the nation. And for whatever reason, there's been a decision not to collaborate with Republicans on this. This Republican will continue to fight for those folks.
And if you fail by the end of the week, are you going to start, what are you going to do?
I'll keep on working, because the fact is premiums are rising by 20% every year for people in my state.
But would you try to forge a deal with the Democrats again?
For 3 years, I've been trying to forge a deal with Democrats. I wish this were bipartisan. Recall, under the legislation we had, we let Democrats keep
because I just want to point out to our viewers here in the United States and around the world, Senator, after this week, if you fail this week, you don't just need 50 votes, you need 60 votes.
Totally.
There are 52 Republicans in the Senate, 48 Democrats. At least 2 Republicans are definitely saying they're going to oppose. Well, let me ask you about Senator Rand Paul. Do you think there's still a possibility that he might support you?
You know, I can't guess what's in Rand's mind, but on the other hand, voting against us is a vote to keep Obamacare. Voting for us gets rid of the individual mandate, the employer mandate, repeals taxes, and gets rid of gets savings of $134 billion for the federal taxpayer. That's a good thing. Hopefully he will vote for that.
And if you lose Susan Collins, it's over, right?
Yes, it is, but people in Maine, there'll be $1 billion for Mainers who are lower income to have coverage, which they do not now have. By the way, $4 billion for folks in Virginia. So it's not just Maine. On the other hand, Susan Collins knows a smart governor who knows insurance well, as she does, could do a heck of a lot to provide coverage for people in Maine.
Because your critics are saying you're trying to buy her off. And your response to that is what? With $1 billion, you're trying to get her vote.
No, absolutely not, because we're also giving $4 billion to Virginia. 2 senators who, even though it's good for their state, are not going to vote for us. We're giving, I don't know, $5 billion to Missouri. I doubt Claire McCaskill will vote for that $5 billion to go to her state. We're giving money to Florida. Bill Nelson, $15 billion to provide coverage for lower-income Floridians. By the way, all this in an attempt to make sure that someone in Maine, in Florida, and Missouri has the same resources as someone in Pennsylvania, Ohio, or New York. And why shouldn't they? Where you live should not dictate the amount of generosity you receive from the federal taxpayer. We try and even it off. That's a good thing. And it's not a bribe. It is a, if you will, for the American people, it is what is right. And whether you live in a Virginia where we won't get your vote, even if it's good policy, or a Maine, we're trying to do what is right.
Senator Cassidy, in addition to being a senator, you're also a physician. I know you're very passionate on this. Thank you very much for joining us. Even if you fail this week, I'm sure the subject is by no means going to go away.